Hi guys. Hello, hello. All right, we're gonna start very soon. I'm just gonna give another few seconds to let everybody come in. Hi. Hi, hi, hi. I'm just gonna give one more minute. All right. So much love. I love it. I love it. All right, I think we can start. Hello, everyone, and thank you for joining our Sensitive Skin and Maskne Q&A with Dr. Franca. For those of you that don't know me, my name is Michelle De La Cruz. I'm the Sales, Education, and Events Manager at Dr. Brand Skincare. And Dr. Franca is going to be joining me soon, but she is a medical doctor, a specialist in dermatology. She has a master in health science and a PhD in psychology. Dr. Franca practices dermatology at the Department of Dermatology and Cutaneous Surgery at the University of Miami Miller School of Medicine. Her main areas of interest are integrative dermatology and psychodermatology. She's also part of our skin advisory board. So we are super thrilled to have her join us for another Q&A because of all the amazing questions you guys submitted to us. We are bringing her back and we're so excited. I'm gonna have her join in very soon. And I know you guys are popping in and showing so much love. I love it. Let me find her on here. Oh, there she is.
Hello,
Hi, Dr. Frank.
Michelle. How are you?
I'm good. How are you? I'm so
Very
excited.
good. Thanks for having me again. Hello, everyone. Hope you are having a wonderful day. And
Yeah.
it's a great pleasure for me to be back here.
Yes. How are you? How's things in Miami? I know it was.
Yes, everything is going so good so far. So far, so good. We had last weekend a lot of rain here. Had a possibility of a hurricane that was actually a tropical storm. So everything ended up working well here, at least in
Yeah.
south of Florida.
Nice. That's good to hear. I know the sun is out, and we also received a little bit of rain, but it's actually nice and pretty now here. So I'm super excited for the sun.
I can imagine. I can imagine. Yeah, Miami is always sunny, always beautiful, but we do face some weather challenges once in a while.
I know, I know. Well, Dr. Franca, I know that we've been with you for a couple of years and particularly focusing on the integrative dermatology. And I'll let you talk a little bit more about that. But overall, as a brand, we truly believe in the holistic approach to skincare, meaning that there is much more to skincare than just the products you're using, of course, but other aspects of our life. So we're truly excited to have you on and share all your expertise with us.
It's my great pleasure, and absolutely what you just mentioned. It's very important. As the largest organ of the human body, we know that the skin is highly sensitive to our emotions, to the environment, that we're exposed to, and also interferes with our social relations. So, in order to understand this complex, it's so important relationship between our skin and all the factors that it can affect it. I have been dedicating the past years of my life, to study integrative dermatology and psychology applied to the skin, which is, the field of psychodermatology. So this is all fascinating. These are all upcoming fields of study, but they're extremely important. And thanks for the opportunity to educating, our followers on these important topics.
Oh, thank you. You're so sweet. I really appreciate that. I know the last time you were with us, we kind of went over the basics of integrative dermatology, but for those who may have missed it, can you give us just a brief overview of what that means?
Absolutely, absolutely. It's a very exciting field. It's an upcoming field of study. We've been seeing more and more publications, new studies, and also integrative dermatology has been present in many different, meetings, nationally and international dermatology meetings. And this is a field of study that encompasses the coordination of traditional dermatology, where we use medication, injections, therapies, light therapies to treat our patients, but we combine these treatments with complementary therapies that have scientific evidence. This is very important. We are not practicing a medicine without scientific evidence. We are combining, the usual treatments with complementary treatments that we know that really work for our patients. And the integrative dermatology approach considers, the physical, biological, the genetics, the way we are born, the information that it is with each one of us, our skin type, our skin color, the diseases that our family carries and that eventually pass by us through our genes. But also, with our psychological aspects, the social part of having a skin disorder, and also we consider the environmental factors that are so important that affects the life of our patients, and so this is a field that encompasses different factors, and we give importance to all of them every time we think about skin and how to treat our patients.
No, I agree 100%. I feel like overall everything going on, and that's actually another one of our questions, is that given the social and political climate going on right now and how stress levels are just at an ultimate high, at your practice, are you seeing or hearing from people that are having like new skin related issues, or that they're experiencing new things that are coming up? I know I personally have heard it from my family members as well. So very interesting to know.
Yes, absolutely. We are all facing challenging times. So I think this relationship between stress and skin, has never been so important. I do have many patients experiencing different types of skin disorders that are, can be triggered or exacerbated by stress. But you have to remember that stress is also a consequence, for many diseases, such as, for example, psoriasis, hives, hair loss, and acne, which is another very interesting topic nowadays. And we know that there are different levels of evidence, with different studies being done, separating each disease. There are groups studying separately each disease. And to understand, better this relationship, how stress can trigger, exacerbate, or be, a consequence of developing a skin disorder. So these are challenging times, and this is becoming more and more common in our practices. And also it's a good moment, to sit with the patient and explain and talk about, some strategies to cope with stress, and how this is important to the beauty and health of our skin.
No, I agree 100%. I mean, we've definitely been hearing from a lot of our audiences, and I know personally from my family members who are like first responders and are in the field and truly trying to help other people, but in the midst of it, they're also experiencing so much irritation, breakouts, hives, cystic acne from just wearing their mask. And it's crazy. We love to call it Maskne now because it's such a common thing where it's being brought up, and given, again, the heightened stress of everything, people want to be safe and, keep others safe, but when they are wearing their mask for such a prolonged period of time, they're getting more and more complications to their skin. So have that been like some of the key things that have been popping up in your office from symptoms?
Absolutely. Absolutely, yeah. Masking, which is this concept, the acne caused by mask. This is what mask means. It's not only a concept; it's a new reality for many of us. And I think we have a lot of this topic is being highlighted by the press, and also we do in our clinical practices see more patients complaining of acne, particularly located on the sites that are covered by masks. Yeah. So what is this mask concept, and why it happens? It occurs like when sweat, humidity. You have to remember they're also breathing under the mask. So, humidity is something that is going on in our face more than ever now. Skin oils and bacteria are trapped onto the skin, while we are wearing a mask. But also face masks, they can cause irritation by physically rubbing the skin, which can damage the skin protective barrier and also, trapping more moisture. So these are the main factors that lead to this masking, or the acne caused by mask. this particular type of acne is called acne mechanica, you know, which includes, this term acne mechanica includes any skin issues that are caused by friction, pressure, irritation, or rubbing. It's a different type than the other, for example, hormonal acne that women usually get around their periods.
Yeah.
It's a different type. It's a more, you know, mechanical type of acne caused by pressure and friction, you know, that the masks cause.
Yeah.
There are, you know, go ahead.
No, please.
Yes, yeah. No, I'm just saying, you know, if you, and of course, if you are, you know, if you're acne, you have like an acne prone skin, this is, you know, obviously it's maybe a more challenging situation for you. But we've seen patients with different ages, you know, experiencing maskne, you know, because we know that this is not only hormonal, it's not only like the teenage acne, it's for everybody who has been, you know, wearing those masks for a long time.
Yeah, it's honestly a vicious cycle because people feel uncomfortable that, you know, these skin issues are popping up and then they're stressed out even more and then it's just getting worse and worse. So obviously, you know, we want to reduce stress in any way possible that we can, but like what are some remedies that you would recommend or things that you would recommend to your patients and things that they can do even when they're at home through this quarantine time?
Yes, absolutely. So, I mean, I always say to my patients that good skincare, you know, requires care and personalized skincare ritual, you know, with products that are appropriate for their skin type, and also sometimes medications that we prescribe in the office to, you know, to treat certain diseases. I also, you know, ask my patients, especially right now, what do they like to do? What type of exercise they practice? How do they usually deal with stress? You know, if they meditate, if they practice yoga, if they just go for long walks in the end of the day, whatever works for them. I try my very best, you know, to give them small tips or stimulate them to do that more often. And, you know, also to educate them saying, well, hey, your stress might be interfering with your skin right now. So let's, you know, try to do more things that you like, more things that, you know, make you less stressed. So we can also help your skin with that. So I always give them small suggestions and tips on how to improve their relaxation methods, you know, and also as again, by doing this, how they can improve their skin health and beauty.
I love that you mentioned like yoga, meditating, and so forth. A big thing that I love doing too is like just sitting down and just having some like nice chamomile tea, reading a nice book where you're just like getting away from the madness of every day. So that's such a big thing, and I thank you for sharing that. And also in regards to like the redness, irritation, and stuff that comes up that we spoke about before, I love how we actually just launched a new product called Probiotic, and it's actually this little bottle right here. And I love that it does relieve that calmness, that irritation. It has those key ingredients like cannabis sativa oil that's going to really just help those skin barriers and help reduce the redness and irritation. So that's just another add-on to help relieve the stress from our everyday madness, and also help with that maskne that we constantly deal with. So that's really great overall. But when it comes to like skincare products, when people are experiencing sensitive skin, like what do you recommend? If it is a new product, what's the best way to test it out and make sure their skin is reacting well? What's your best recommendation?
Absolutely, yes. You know, so I try to keep things simple with the patients, particularly with the ones that complain of sensitive skin. So I always say we need, you know, to choose the right cleansing product for you, a good moisturizer and a good sunscreen. And it's particularly now for, you know, for female patients that you're all wearing masks, I tell them try to, you know, use less makeup or avoid makeup because right now you don't need it.
I know.
And but in terms of, you know, cleansing, it's very important, you know, to use a product that are like neutral, that, you know, with minimal skin residue. So because we know that, you know, cleansing is a very important part of the skincare and should be done at least twice a day, you know, in the morning and at night, with a product that is neutral and good for your skin type.
Yeah.
And in terms of moisturizers, moisturizers are also extremely important, especially right now that people are using masks. As I mentioned to you, the friction and just the contact of the mask with the skin may remove our, skin protective barrier. So putting a moisturizer is a way of preventing this irritation and also preventing acne as well. So for people that are like in the summer, now I would say to a very light moisturizer, and for people that are in countries where it's winter or it's cold, you can use something a little bit heavier. But in terms of sensitive skin, we know that certain components are more likely to cause less irritation.
Yeah.
We know the hyaluronic acid is something that also helps to protect the skin barrier. And lipid complexes and ceramides are very good ingredients to strengthen the skin's barrier function. And there are many pediatric products. There was a consensus published this week, this month. I was just reading about it yesterday. It's a recent paper showing about the importance of ceramides in products for pediatric patients. How good they are to keep the skin barrier. So that's an ingredient that I always try to find in certain products and suggest that to my patients. We know that these ceramides restore the skin water permeability and the barrier function, and there are some interesting studies suggesting that low skin ceramide is a major factor for certain skin diseases such as atopic dermatitis, which is more chronic. That's why they are using it for as a moisturizer, for kids, but also for adults with sensitive skin. So it's a good ingredient.
Yeah, I
And
love
in
that you
terms of
mentioned ceramides. No, I was just gonna say I love that you mentioned ceramides because it's actually one of our key ingredients in the Probiotic redness relief, and how you mentioned also in the summer how we always want to make sure we use something light. I don't get too much redness and irritation, but what I do notice is when I am out in the sun and I'm getting burnt and I'm getting all those redness from the sun, I love using this right after when I come inside, and it's like you instantly feel your skin just feeling super relaxed and calm. And within the same family, we do have the Clean Biotic. So I love washing my face with this. It does have that chlorophyll that also goes into the skin, especially for sensitive skin. So that's one of the biggest things that I love about this collection in total. And we actually did think about doing a bundle that's going to be specially for Maskne and wearing the mask, because that's such a big topic right now. So soon to come more on that, but we're super excited that we do have this collection. And yeah, this is some of the key ingredients that you just mentioned that are in the product. So we're super pumped for it. So more to come on that.
Very nice. And also never forget about the sunscreen, for sensitive skin. I recommend the physical sunscreens because they don't have like chemicals on it. So with products containing titanium dioxide and zinc oxide, are the one that patients with sensitive skin should give preference to, because they are not, they're not entering the skin, and they're gonna protect you, but also tend not to cause irritations. And what you asked, I always, I say any product, sometimes a product is considered relatively hypoallergenic to the majority of people, but some people might develop, rashes using a product. So we do recommend a patient to do what we call self-patch tests, apply a small amount of the product in other areas of the body, could be in the arms, and leave it for some time before applying to the entire face or using a large amount, just to see if it causes an irritation to that area, and that the product goes well. For patients that develop constant dermatitis from certain products, there is a formal test, it's an allergy test called patch testing that, certain dermatologists are trained to do it. We do tests. There are panels. I'm one of the persons that do this type of test in my department. So we do have panels that are standard panels that certain companies produces and send to us with the most common types of allergens that we call. But these are like preservatives, perfumes, fragrances, and sometimes some types of metals. And we place those patches on the patient's back. Usually that's the location where we choose. And the patches must stay for 2 days on the back, and then we remove it, and then we start doing a sequence of readings to, to find if that person has an allergic reaction to that particular component. So that's very important, because by the end of the test, we're usually able to identify the ones that the patient are allergic to and propose them the right products, or the products that are not going to cause them allergies.
That's such an awesome tip. I never knew that. So that's very good to know. I know a lot of the audience were curious on that. Someone asked actually if a silk mask is helpful on the skin versus the regular mask. Have you heard of that before? Or
yeah, I heard about that, and I've been reading about it, about the types of masks. We know, for example, the N95, the World Health Organization, the surgical masks is an N95. N95 is the number one in terms of protection. We are reserving those for healthcare professionals, and for those that are fighting COVID in the front lines. But for the rest of the population, they're recommending at least 3 layers of other types of could be cotton or could be silk. So for skin, will be cotton and silk are the ones that are likely less. They're going to cause problems in terms of acne mechanica. So 3 layers of cotton, a breathable mask that also should fit your face.
Okay.
Might be an option, if you have the possibility of using other types of masks. We recommend you to change them very often, because that's a problem if you keep the same mask for a long time. And wash your face before putting the mask, and once you remove it, by the end of the day, again, wash the face again with the right product for your skin type. So yes, silk and cotton are options, for patients, but make sure they have the correct layers, the amount of layers.
Correct.
They should be breathable, but at the same time, you need to have the right protection. So I guess, putting the right amount of layers, you might be able to, reach that. There are certain studies now that are trying to, experimental studies, trying to compare the different types of masks, how many layers will be needed. We're still following, those studies to see what is the most accurate information.
That's good to know, and I know that a lot of people were curious on that. So as long as it's a silk mask and it has those layers, then they can for sure use it. Okay.
Yeah, they could use it's recommended. We know that any type of mask is better than nothing. Right now. So we are, there are different types of masks that are more appropriate than others, but silk could be an option. And there are people doing, for example, 1 layer of silk with 2 layers of cotton. So, maybe the one in touch with your skin, if it's silk, should be fine. And then as long as you have the, the layers and the minimum amount of protection, and that, and of course, social distancing, doing the rest of the work that everybody now is trying to, all that help us to be a little bit more protected and protect the ones around us.
I love that. We actually had another question, and they asked, how long does it take to see if a product is working or not? That's a very good question.
Yeah, it depends how long is a product is working. It depends on several factors. If your skin is oily, if your skin is more dry, it's going to absorb the product more quickly. So it depends on several questions. There's not exact a specific time for that, so it's hard to say. But I would say to you a couple of days, and some people a couple of weeks, you should see, like at least if you touch the skin and you feel the skin more moist, if you're looking for a good moisturizer, you should see those properties of the product working. So, and at the same time, if you have an allergic reaction, you're going to see it, very soon as well. So, if the product is irritating, I would recommend not to use it.
That's good. That's very good. Very helpful. And I know we're good on time, but I just want to allow at least 1 or 2 more questions before we wrap up in the comments. Fabric. I know we mentioned earlier about how there's different ages in regards to, some of the skin concerns that people were having. What would you say is how to treat it? From somebody that's in your teenage years to somebody that's in your 50s, when you're dealing with skin irritation and so forth, how would you go about it?
Irritation, yes. Yeah, so I mean, one thing, for example, the teenagers and going back to skin irritation and slashing maskne, for example, we know that the teenagers, they tend to have a more prone oily skin and they already have hormonal issues going on. So often in these patients, we need to be a little bit more aggressive, sometimes prescribing, topical products or even oral medications to treat their acne. So right now I've been seeing an increased number of teenagers in my offices because they already have the hormonal acne, plus they have the maskne, so we're facing this challenge right now, trying to keep their acne under control. While somebody who's in their 40s or 50s, some of these patients that already have more the hormonal issues. So we are talking about more about like the acne mechanica or just a skin that is very sensitive by using the mask. So for those patients, we go back to a very good skincare, personalized with the right products, perhaps promoting more moisture to the skin than, giving them aggressive products that we use to treat hormonal acne of the teenagers. So we do have, specific treatments for each age group. And obviously we know as the time goes by, the skin tends to become more dry. So
Yeah.
a little bit more attention in terms of moisturizers for the ones that are aging gracefully.
I love that. I love that you said for earlier when you mentioned the hyaluronic acid, because we do have the hyaluronic facial cream, and that one's super good for like expression lines that we deal with. But also, I wanted to ask you because I have a cousin that works in the medical field, and she has a really deep line here from the mask. But she has been using the hyaluronic facial cream with her products and everything else, but she was looking for maybe more procedures in office. Is there something that she can do to help combat that? And I know other
Yeah,
people.
absolutely. Nowadays there are many, lasers and also, fillers, things that she could be, reaching, to a cosmetic dermatologist to see, what is her situation, analyze her skin and see how they could perhaps inject. We know that there are fillers that have hyaluronic acid in the formula. So that go a little bit deeper. They're not only topicals, but they go deeper. They're injected into the skin and also could help to, make those lines, uh, more smooth.
Nice. Well, when I go to Miami, I need to take her with me to visit you.
Absolutely.
But I know we're about to wrap up, and I just wanted to bring up one thing that we didn't talk about, and it's our newly launched virtual skin consultation for anyone who is on and love this one-on-one experience. You can have a one-on-one free expert advice with our Dr. Brandt skin expert, such as myself, and we will actually post it live after this. It's going to be a swipe up in our story, so you can book your consultation online. And then we also are, again, like I mentioned, going to do a bundle to combat maskne. So we would love everyone's feedback on the bundle, and feel free to share your ideas, DM us in our comments, anything that you think of. And in regards to the maskne itself, we do have a questionnaire survey. So if you click the link in our bio for the audience, you can for sure get a chance to win some of our biotics collection, like I mentioned earlier, some of the products, and it will potentially also have our new cool biotic in there. So we're super excited for this launch, and I just wanted to thank you, Dr. Franca, for all your time. You have
Thank you very much for
so
this
wonderful.
opportunity, and I wish you, a great day ahead, and to our followers, a healthy and successful journey.
Yes, thank you so much. And thank you everyone who was watching. We really enjoyed having you guys. All your great questions. If you have any more, feel free to reach out to us. We are super excited and we can't wait for the next one.
Hoping for the next one very soon.
Yes.
Have a wonderful day.
Thank you
Thank
so
you for
much,
having
Dr.
me.
Franca. Bye, guys.